Next, I will be demonstrating how to set up a dressing tray for wound care. So first step is always introduce yourself to the patient, in this case as a student nurse. Making sure the tray is set up at waist level to maintain that sterile field, and always being conscious not to turn your back to the patient. So you would wash your hands, dry them, and then put on clean gloves. So for the setup of the tray, they just have to be clean, not sterile. The sterile ones will be for later. Make sure with the client if they need to use the bathroom before you start. So inspect the package, make sure that it has everything in it, make sure there's no tears or rips in it. Open the package. So you'll start with opening the top flap and then the sides, always grabbing by the edges, and then the bottom flap. I have a bit of a makeshift kit here, but the principles are still the same. And then using the forceps, you will remove the items. So there are a few items that you can place on the client, like on their legs on the bed, depending where the wound care is. Things such as the drape and the garbage bag. And then there are certain items that must remain on the sterile field. So those are things such as gauze pad, bandages, and the solution, which is sterile saline. So you would want to pour the solution into a cup, keeping it on the sterile field. And then once everything is set up on your field, you would then be ready to start wound care for the client. So at that point, you would take off your clean gloves. You could toss those into the garbage bag that you have on the bed. And then you would once again wash your hands. And then you would come back and you would put on the sterile gloves that we were using in the first video there. A new pair, of course. And then the biggest thing to remember is you always want to remember to keep your hands above your waist level as you're operating around, and that will help to maintain the sterile field.